acid sphingomyelinase deficiency, or ASMD, is a very rare metabolic disease that belongs to the group categorized as lysosomal storage disorders. When certain substances are no longer useful in our body, they can be transported to the lysosomes. Lysosomes are closed compartments in our cells, specialized in breaking down and recycling substances by using lysosomal enzymes. In healthy individuals, the enzyme sphingomyelinase breaks down the substance sphingomyelin. In patients with ASMD, this enzyme either does not work or not adequately enough, so this breakdown does not occur. As a result, sphingomyelin, a type of fat molecule, accumulates in the lysosomes. One of the consequences is that some organs become larger and no longer function properly. ASMD can be divided into 3 types: A, B, and AB. Children with type A usually have fairly normal development up to the age of 6 months. Between 6 and 15 months, development stagnates, followed by rapid deterioration. Due to muscle weakness and general weakening, they are no longer able to take up sufficient nutrients. Often, respiratory problems cause children with type A to die before reaching their 3rd birthday. Children with type B grow more slowly, and sometimes puberty begins several years later than expected. In early childhood, enlargement of the liver and spleen occurs. Fatigue, joint pain, and decreased bone density are common symptoms. Liver failure, severe respiratory infections, internal bleeding, and a damaged spleen lead to life-threatening consequences. In type AB, the symptoms of type B develop, as well as certain neurological problems. This may include ataxia, learning difficulties, and delayed development of motor skills. ASMD is a disease with a genetic basis, meaning it is inherited from an individual's parents. Of all the genes we possess, we have 2 copies, one inherited from the mother and one inherited from the father. The disease occurs when a person inherits changes or mutations in both copies of the affected gene. If a person receives one normal copy of a gene and one altered copy, the person is a carrier of the disease but shows no symptoms. Meaning that even if both parents are carriers of the disease, it does not necessarily mean that their child will also express the condition in the same way. The non-neurological problems in patients with type B and type AB can be treated with an artificial enzyme which is administered intravenously every 2 weeks. This artificial enzyme then takes over the tasks of the defective enzyme. This greatly improves patients' quality of life. Unfortunately, the artificial enzyme cannot suppress the neurological problems in patients with type A and type AB, as it cannot get into the central nervous system. The number of men and women with ASMD is about the same and is estimated at 1 in 250,000. The disease has a great impact on affected families. So we want to help address the symptoms and gain more control over ASMD. Head over to www.mpuk.org to discover more and learn how you can support the community further.